Okay. So, hey everybody. I'm Imani Lucas. I'm from an organization called United and Guided. I will give a few more minutes as people sign on, get back from their lunch break. But I'm really excited to be here today and speaking in front of so many, distinguished professionals out there. And I see several people from DDS, Sacramento. I see the Priority Center Orange County. Welcome, Bill. Welcome, Jayla. Welcome, Morelia. All right, Santa Clara. Okay, Summer, Christina. Welcome, you all. All right, that list is getting pretty vast, so I won't go into everybody as I continue, but I am very happy to have you here. Please send us a shout out through the chat as we move forward. Okay, so this is my first time with Wovia, so I am or Wova, and this is my attempt to make sure that I am sharing screens properly and making sure that we're moving through the part of the presentation smoothly. I have Mr. Nathaniel, who's got my backup as the co-host, and I want to thank him graciously as I'm still learning the system here. So. Bear with me. If I could get a thumbs up, if you see my screen, I can go into slideshow mode and then we can get started. Okay. All right. I see Kristen's thumb up. Thank you. Okay. So here we go. Today we're talking about joy to justice and how a small community-based organization is using community engagement strategies to increase involvement in case management strategies. Our organization has we originated in 2018 but really started to get to work around 2020, where some of the laws were changing in the middle of some things. SB 803 came out and said that outpatient services, community-based organization had access to them, and they could charge fee for service to Medi-Cal once they become qualified and connected to a managed care plan. We have been very blessed to be the round two recipient of PATH-cited funds, and that created the opportunities for us to get contracted with managed care plans with Anthem, Kaiser through their subsidiary independent living systems. And then to be able to work with Medi-Cal members and provide enhanced care management and one of the 15 community supports, which is dehabilitation. So, what we hope you'll walk away with, I want to try to get through the slides so I can leave some time for us to really engage, to just talk about different strategies for engagement. But what we hope you walk away with is community engagement ideas that build trust, at least three practices that reduce barriers and strengthen the social determinants of health. We also want to show you some economic supports with dignity, give you an example of our engagement strategy, which we call Funky Fresh Friday, and how we use it to engage into hard to reach populations. And then lastly, we want to be able to explain how this fits into enhanced care management and to peer support through CalAIM and the Behavioral Health Service Act. So, how some of our strategies have already been quite positioned to be able to withstand some of the changes that happen with Proposition 1 and the Behavioral Health Services Act. So we'll talk a little bit about that as well. Um, so, but first, I want to give you a little history about what we've gone through as a small community-based organization with individuals with lived experience. So, the five of us formerly worked for youth development organizations and other types of nonprofit. when we decided to move forward with United and Guided, it was under a general contract with the our county's perinatal. I'm sorry, our public health department, our CDPH, who ran the Perinatal Equity Initiative. And our main goal was to gather fathers and to be able to promote more fatherhood, and then particularly how it related to the sister organization, Black Infant Health, and how we can better support the fathers who are actually part of that sister initiative. So, but over the time, we saw some definite changes that passed, and the structuring of how we look at public health and how we look at fatherhood, how we look at parent maternal health services, right? Some of those things changed along with Congress and some of the rules. So at the very beginning, when we got started, 2020, the pre-COVID, it was under the Mental Health Services Act instead of the Behavioral Health Services Act. Community supports were considered CBO in lieu of services, meaning that they were just a part of the clinical practices that were happening with the managed care plans. Um, we also did a lot of the evidence-based programs. I remember a time when evidence-based programs, you would go to the Department of Justice, you'd pick out something that fit, what your population was going for. And then as long as it was on that list of the Department of Justice or some registered base program, we were able to kind of move forward with it. There was also a different level of outreach when it came to, pre-COVID, a lot of tangible outreach where you can pass flyers, you can do periodic events like, backpack giveaways and all of these nice seasonal events where people can come together and, try to give out to the community and give back. All right. The General Homeless Management Information System, HMIS, was labeled as that. In Sacramento County, we work with Sacramento Steps Forward. And some of that's changes. And all of this was kind of under between 2020 and 2024 as they were changing some of the rules. Now we get into the post-COVID on the right hand of the screen. That behavioral health is starting to change, and over the years, we started seeing an emphasis on lived experience and community-based organizations having the opportunity to provide fee for services, right? That was a big part of SB 803. That was why a small community-based organization like ours started registering in the state PAVE system to become certified community health workers and certified doulas. So both are billable Medi-Cal services that you can get into with purely your lived experience over whatever your degree is. We also had the foresight to get trained by Cal Voices for mental health peer specialists, and then move on forward to take the state test with Cal Mesa to be able to provide peer support services. And, as this pertained to our fatherhood work, it became an opportunity for us to work with mothers and fathers to be able to help, and particularly in the postpartum phase of the pregnancy where the emotions get tight and maybe it's necessary for some conflict mediation strategies and ways that a peer specialist for the mother and the father could move forward. Okay. But, our post-behavioral health, we dealt with COVID and we dealt with being quarantined. So the outreach actually changed as well, right? So, where flyers in that direct periodic contact was the norm, Now more so people are learning through digital methods. People learn more on YouTube and TikTok than they actually do sitting in these structured groups or programs, right? So the change is different. We're seeing the trend go from programs to actual services, right? Because human beings that are hard to reach have a general distrust of programs and government at large. But, if we change our paradigm to understand that we're not trying to program anybody, we're actually there to serve. Maybe that's a different intonation, and that's going to take some consistency. And the way that we do that is through digital outreach, the email, social media, website links that bring people back to our website to fill out the intake forms, and then either virtual or in-person calls as we work with them. And then, the homeless management information system has even slightly changed, right? They label it the coordinated access system now. And we had to go through an entirely different training and really upgrade our skills to be able to work with homeless individuals within that system, whether they be fathers, whether they be transitional age youth or the like. Okay. So, we through our partnerships and our subcontracts now, United and Guided is in a very unique position to meet some of the changes that happen through the Behavioral Health Services Act. So we're able to provide fatherhood support services in collaboration with Sacramento County Department of Public Health through that perinatal equity initiative is still going. And through that, we were able to develop our co-ed doula services, which we got certified through PAVE, and then we are a registered provider with Kaiser HealthNet's Plan of San Joaquin and Anthem in part. And then, so we also have a main contract to provide uh, enhanced care management and rehabilitation services through CalAIM, and that's through a connection with Anthem. Our rehabilitation service focuses on employment help and job coaching. So we partner with the SEIU, we partner with the Futuro Health, and they have a program that is helping people get through and get certified as peer support specialists, in-home house services, a few other, I think LVN may be one of them as well. However, we are working with our rehabilitation members who are typically Medi-Cal members. However, it's not restricted to that, and they can come and participate in some of those career building services. We also try to match some food insecurity for our Anthem Medi-Cal Enhanced Care Management and Rehabilitation members through Project Food Box, which provides medically tailored meals on a weekly basis to registered and qualified Anthem members that work with United and Guided and others. Okay? But we've also taken that, oops, sorry, go back. But we've also, taken our time in between 2020 and now. We're a small elite team of enhanced community health workers, but we've all been trained as Medi-Cal community health workers registered in the state system to provide that service. And then all of us has taken CalAIM, Cal Voices training. Two of the five of us are fully state registered with an MPSS designation and everything. So the team is building. We also have certified doulas, both male and female, which is also registered through the PAVE system with the state. And for our co-ed doula support system, it's unique in the sense that we do have certified male doulas to work on the team. However, that's not the highlight. The highlight is the actual doula service for that mom and dad, and then to be able to help, communication be better and help the strategy for raising the baby be better, regardless of in you're still in a relationship or not. So we've had cases where, that is kind of the situation, and we're able to provide, structured conflict mediation to help people. We try to reinforce with our couples the nonviolent communication, which we learned as peer specialists. So there are several ways that we can insert ourselves in that. Okay. But we've narrowed down our population of focus to include fathers experiencing or and at risk of homelessness, joblessness, asthma, community violence, ex-incarceration, domestic violence, and or the biological fathering of a child. If you are the biological father, we've had dads that have had issues being involved in the child's life for whatever friction, they may have had with the mother prior or with the mother's family. So, there are fathers who sort of struggle to be part of their children's lives, and we've been blessed to be able to help some of them. But we also have a focus on our transitional age youth, people 18 to 35, around these ages, that are experienced, if they're pregnant, they're going through a childbirth, they're at risk of homelessness, joblessness, asthma, community violence, ex-incarceration, or domestic violence. We our main strategy, of course, through our subcontracts with Anthem to provide that enhanced care management and rehabilitation, we can work with, all active Medi-Cal members, but our service is open through the community because we are enhanced community health workers and are able to build directly through Medi-Cal to provide that community outreach services for people who may be uninsured. So, we leave a lot of room open and to be able to open up and engage in folks or with folks. But we look at, that part as a small component of a three-pillar component. So, we have gotten very good at providing these consistent outreach activities. Before our Funky Fresh Friday, we used to call it Self-Care Sunday when we were gathering fathers at Tahoe Park here in Sacramento County. And every Sunday we'd be out there with barbecue and, just inviting dads to come out and play chess. And we had our local youth out on the basketball courts, and fathers would actually volunteer to engage in basketball with folks. And, lots of different activities would happen on any given week. But the most important part of that was the consistency. And so that's where we look at joy-centered engagement as a primary component of our overall work. And, the joy, it's having something consistent. It gives that sense of belonging, family voice, and then it's a safe space that people can depend on. So even if you don't feel like coming, one week, you may feel like coming the next. So we've had times where we've had 5 people there, and then we've had times where we've had 500. So it fluctuates, and it just depends on how people are feeling, but it's a non-intrusive way for us to be able to describe our services, but at the same time, not pushing it on anybody. And then they get to know us first, get to build trust, and feel supported that way. And that's when we start to see folks go online and start to fill out intake forms when they can trust it. Okay. The next, of course, is the economic supports, right? What was different about our initial efforts on Sundays to Funky Fresh Friday is that we're testing out a monetary system to where people can feel not like they're coming from a soup kitchen, but that that they're actually earning something for participating and being friendly with the staff and caring for others on this thing. We'll talk a little bit about that as well. But those incentives and resource exchange gives that sense of dignity first. And for a hard to reach population, a lot of the mistrust that they have for authoritative figures, has a lot to do with not feeling dignified when speaking or conversing with them. So what this gives is an opportunity for people to feel whole at least once a week when they're hanging with us, right? And that establishes dignity and it leads to self-respect and trust. Another important social protective factor that leads one from non-engagement to engagement. And then, of course, part of the strategy is to have this access to the care coordination. And, as we meet people every week and get to know them, they can also earn incentives by participating in some of the behavioral health strategies. So trying to get your health together. And it provides that access to referrals and clinical care. And then it also can potentially decrease hospitalizations when people have a solid place where they might go to weekly for resources. Okay. So our joy is as a prevention strategy. We think it creates safety and belonging plus dignity. And then it's led by lived experience. Folks out that come out are actually people in the community, and some of them are hungry families to where if they got a hot hamburger and a hot dog, we have some dads that bring all of their children out on Fridays just to enjoy that. We have music. We do karaoke out there, so to watch people come off the street and then singing their favorite song. We're in a great location in Sacramento to be able to do that as cars are passing by, watching grown men sing their favorite tunes. Mine is New Edition. But as we move forward. And then, it allows people to be able to engage stigma-free, no judgment. As long as you're not rude to the people around you, you're welcome to stay. And if you happen to be rude one day, you'll be asked to leave, but also it'll be open to come back. So that is where the dignity comes in, and that is where the non-judgment comes in again to try to reach hard to reach populations. Okay. And so, our key component to all of this is trying to do something that is consistent, just creating a consistent engagement opportunities to reach populations who, struggle with trust in the first place. So just to be able to take those baby steps and gain some of that trust, helps decrease arrests and prosecutions and hospitalizations in the long run. Okay. So I hope that this works because I want to show you a video it's a 46-second video of what we do at Funky Fresh Friday. This is our first flyer, and we were able to get some corporate support. Of course, Anthem and CalAIM provide the major support, but being involved with the SEIU, the co-working space where we rent the building from is called Capacity. They've gotten involved. Of course, the Black Fathers Inc. from the Perinatal Equity Initiative. And then some of our other founding partners that were courageous enough to come out and have tables for Funky Fresh Friday. So I'm going to try to click here and hopefully it'll take us to the video. Can you see that? Thumbs up. All right, let me put on the sound.
Imani, we're not hearing it
Yeah,
very
could you
well.
turn it up? Yeah, Lucas, turn it up a little bit more.
You might need to share your computer sound, which is an annoying thing that Zoom does. You have to.
Okay, maybe we can try to do that now. This is where I can use you, Nathaniel, or anyone that's willing to help.
So I think if you stop screen sharing
Uh-huh.
and then now click
And then
share, and then at the
share it again. Okay. Let's.
right, but first at ooh,
So I'm sorry, hold on.
no, you're fine.
Jumping the gun.
So when you click share
Uh-huh.
on the right, do you see where it says share options? And there's a checkbox for share sound. Make
Yeah.
sure that is checked.
Gotcha. Okay.
That should allow us to hear and see.
Okay. All right,
Then
let's
you can
try this
select your
again.
screen. Perfect.
Thank you. And then, so if you can give me a thumbs up if you do hear this version, I would appreciate it. All right. Funky Fresh Friday. How UAG, we out here at Council. That work? Excellent. 5810 Broadway, come see us.
Fridays, every Friday, starting today. Come get your stuff together. Housing, doula support. If you're on Medicare, need a doctor. If you need Medicare, need food, clothing, shelter, mental health support, come see us.
That's right. On Funky Fresh Friday, however, if you want to sing, you want to eat, you want to dance, you want to have some fun, come out and be part of Funky Fresh Friday. We got a dollar store, thrift store down here if you want to come check it out. We got cornhole, we got Uno, you beat me in Uno, you win a couple bucks. Come on through 3810 Broadway at the Capacity Building, United, doing our thing.
Peace.
Y'all heard? All right, so I hope you heard all of that. It is fun. It can be found on YouTube as well, on our site. I do see a hand. Vanessa, is that you? Did you have a question?
No, I was trying to put a reaction. Sorry about
All right,
that.
okay. Well, thank you. Okay, so so just wanted to not just be a bunch of talk without like any display of action. So I wanted to make sure that we all see that this is a practice that we have been trying to do and be consistent about. Feeling that, with that consistency, we'll be able to do better outreach through digital channels and in-person channels, just to keep that party going. So let me make sure, did I get back to my screen or are you not seeing that? Okay, here we go. All right. So that's Funky Fresh Friday, y'all. It's our weekly stigma-free community space. We are out there and we get all walks of life that come. Our doula families, our fathers that come out, our seniors that live in the residences nearby the neighborhood. They have liked to gather around. People who may not necessarily be on Medicaid, but they're on Medicare. And we've been able to help some of those folks, through our community health work, we're able to help them that way. We always have a place, whether it's rain, sleet, or shine, for somebody to come and be able to get hot food, which, as we've gone along, started to realize just how important that is for some families that walk by. It doesn't cost them anything. They earn it just by participating and signing in. You'll at least get fed some of those items there, right? And then our design principle, of course, is that help should be easy to receive. We've had times where folks will come in and they'll just inquire about what we're doing on Fridays, and then realize that after we've kind of given them some QR codes and things to look at online, we'll see an appointment and sometimes a opportunity to create a personalized care plan for them, which, we have a process online for that as well. Right? So it all revolves around the UAG buck, and when we first got started, I was buying Amazon, fake dollars and things like that. But my great staff like really got into it and really just wanted the understanding of the UAG bucks and created this design. So now we cut and laminate bucks that look like this on the screen. And we distribute them. And so we're trying to create an economy where, the value of those bucks make sense for our community coming in. So, just for signing in, folks get to get a couple of bucks. That's enough to get them a cheeseburger, a hot dog, and a drink. And well, we do water, and some chips and things like that. And then you're able to earn more just by the more you participate in the group. But what it is our community currency that's tied to kindness and participation. And it's earned by attending, completing the sign-ins, connecting to the resources. We have a QR code for a PHQ-9. You can take it privately, and then we can contact you. We do the same with a QR code that we use for ACEs tests. So, people participate. They get into that. Their information is held private through our SurveyMonkey account, which has a BAA license, which protects our security. And, we can work and reach out to people who do those types of surveys. And just to get a bigger picture, we invite them to create a care plan with us, right? And so, it could be redeemed in many ways. Of course, I mentioned being able to get hot food, but we also have donated clothes, mainly donated from my wonderful staff. And we just use our stuff and we have it out on hangers and we created a community dollar store. So now people, we have homeless people that come in and they get their exchange of clothes because they sign in or they'll, take a selfie with some staff and get a couple of other bucks and they're actually shopping for those clothes, just trying to keep the fresh supply when they go where they go. So it does have its impact and we love what it's doing. All right. So, as I mentioned, there are several ways that you can earn bucks. Here are just some of them. You'll see, signs like this plastered around tables all throughout the site. And people can do certain things to earn bucks. What's not there is singing in karaoke, which is the biggest prize winner. You sing a song, you get 50 UAG bucks to spend how you like. But again, we have the price structure of what you can earn for dollars. Our partners that come that represent organizations, we'd love for them to sign a resource table with us. Partner, perhaps you can be a guest DJ or a guest chef, or just to have your organizational resource materials out there. That's important. You get 60 UAG bucks just for that, just if you want to distribute them to the folks who come to your table, things like that. Right? If you want to volunteer, you can make UAG bucks helping us with the setup and the cleanup. And, as we continue to get our corporate donations, the more of them we have, I actually pay gift cards to folks who volunteer for both the cleanup and the setup. So just a lot of different ways. And this way we make it so that you're not just receiving a handout. You're actually being compensated for building community with others. And if that takes a little incentives, it's a small price to pay for people to be able to not be hungry on Friday or have a hot meal. So I feel like it does have its impact. Since we got started in October 31st, the impact has been significant in our eyes. You know, we served about 789 meals and counting. And then, you know, through that, we're able to build relationships with the people that have come to the events. And you know, 56 of them since we last counted have applied for health benefits reviews and scheduled appointments with us to get their personalized health plan started. So altogether, 182 males served, 170 females served, and about 101 youth served, which is an even mix of families that come out and be part of the event. Okay. And so, you know, we talked about that economic supports, the incentive things. We talked about initially how that integrates in the care coordination part of it, right? So we understand that, you know, joy could be a central tool for engagement and community development. We understand that maybe having a incentive program could be one strategy to be able to get more engagement for hard to reach populations. And then, you know, this part really talks about how all of this work integrates into our case management work and how some of the shifts from, you know, what originally started as CalAIM may be moving toward the county health departments under the Behavioral Health Services Act. So for us, we feel like we had been in a good position and we've purposefully been positioning ourselves to be able to live in both worlds, to be quite frank. You know, we are you know, uh, we are mostly folks that have lived experience getting through the system. We're a small group of 5 elite folks with the proper training and designations to be able to operate on the non-clinical end. And we want to make sure that the community understands that we're not trying to replace clinical care, but just supplement it by being able to address these social determinants of health effectively so that the clinicians can still focus on the care and some of the medical remedies. Okay. So with CalAIM and our community spaces, the enhanced care management and rehabilitation, they form the bridge from engagement to sustained care. You know, we are all registered with with our county's CAS system, coordinated access system. Excuse me. And so we're able to work with folks regardless of whether they are a CalAIM member or not, or a Medi-Cal member or not. However, you know, the idea is to, you know, quickly get the uninsured, at least with some type of Medi-Cal or health insurance, so they can move forward because the bulk of the benefits for them, at least as far as the homeless population, are going to be coming from CalAIM right now. That may change, but right now CalAIM is the partner. The managed care plans are controlling that level of funding. Um, you know, for community supports, there are 15 out there. There's housing transition, housing deposits, ways to help people become housed. And then there's rehabilitation, which is sort of a combination of the care management, but then also, you know, we integrate career coaching and skill building into that. So for our offices are open between 11 and 5. For any member of the community that wants to come and use our computer systems to get things done. If they're interested in career building and job coaching, we help them revise their resume, their cover letter, and to create a LinkedIn account that is effective. And you know, we'll help them post on Indeed and the Career Builder search engine. So at least getting people there to get started. And for those who are interested in public health careers, they can go through our partnership with SEIU and Futuro Health. Uh, as I mentioned, there is on unitedandguided.org. We do have a blog site where we kind of label that journey. I want to invite you all to take a look at it if you get a chance. Okay, so all in all, we're just talking about practical integration, our staff workflow, our referral capture, our follow-up cadence. We're and it's still a work in progress, but we have a digital process that makes it very simple for people to get engaged in that way. Once that barrier of distrust is broken, then it makes it a lot easier for people to learn and use those digital methods. So, and then, of course, making sure that our staff is properly trained and able to provide, are able to utilize their lived experience to provide these much needed services. So, for a small team like ours, our grand vision is to be able to replicate these small interdisciplinary teams in several counties, particularly those rural areas that struggle to be able to reach that hard to reach population. Okay. But we're also very mindful of the shifts that are happening as well, right? The behavioral health workforce. And, it's great to see so many of you that represent, county behavioral health on this call. So, there's probably many of you who know much more than I do about this, but I'm hoping that we can continue to kind of learn the system changes together, right? So, basically, for us, trying to build a workforce of Medi-Cal peer support specialists, enhanced community health workers, Medi-Cal doulas, enhanced care managers, and rehabilitation specialists could be this type of lived experience multidisciplinary team that can work locally in different jurisdictions, and with one engagement strategy, it just might work to, bring more people into the fold, get more uninsured people insured, and then maybe reduce some of the emergencies that happen in that particular county. Okay, so lived experience plus navigation support equals sustained engagement and care. Okay. This also does great things for our birth equity services, our prevention through perinatal equity. And, as I talked about in the very beginning, our foundation is around fatherhood support and being able to help more fathers go through the perinatal and the postpartum phases of pregnancy. But why? Right? Why include fathers and partners in birth equity? Right? And I think many of you, I just saw a great presentation earlier in the first half regarding fathers and fatherhood, and that's part of our California Fatherhood Council. So big ups to Dutron and the folks that put that together. But I think by now we know some of the statistics that they result in better outcomes for mom and baby when the father's involved. There are stronger protective factors, less isolation. And then, it also brings us back to a cultural thing that we used to call the whole family system, right? Before it got so easy to sever ties, with the father sometimes or the mother and not have any opportunity to reunite, co-parent, or be part of that baby's life from a strategic standpoint, if it's not an emotional one, right? And it will also lead to better postpartum health, particularly, after the child is gone through the 2-year-old stage and soaking up new information, just understanding as you start to understand the English language and walking and basic things. For many children, they have the blessing of knowing who both of their parents are, or more importantly, knowing who and what their parents are. And for some folks, it may not be like that. And if we can do anything to repair communication and repair some of those disparities, we may be able to do it through our co-ed doula service. Okay. And it's just a peer-led, culturally competent support for all expecting mothers and fathers, regardless of if you're Medi-Cal or not. If you're expecting mother and father, you really want to try to work that out together, or if you're just a single mom that just could use a circle of support, we are willing to work with all moms and dads. Okay. And then, of course, by being peer specialists and ECM providers, it's that link to the behavioral health, conflict mediation, bonding, and those protective factors, right? Particularly the bonding area, which comes from that consistent engagement from Funky Fresh Friday, among other things. Okay, so why does this model matter for California? United Guided supports the statewide initiatives. As we mentioned, we're part of the CalAIM initiative, which of course is that enhanced care management, community supports, the community health worker, CHW workforce, and our Medi-Cal, doula care workforce. But then also understanding when Prop 1 hit, and Prop 1, which changed our governance from the Mental Health Services Act to the Behavioral Health Services Act. And then they pivoted a little bit. At one point, CalAIM was awarded $1.3 billion to try to provide innovative strategies to improve the Medi-Cal system. However, that it still remains to be seen how much longer that initiative is going to be funded, because Prop 1 changed the focus of homelessness and mental health to the Behavioral Services Act. And some of the biggest pivots were that, as CalAIM focuses on housing and infrastructure investment, trying to create more beds for this ever-increasing population of homeless folks. The PHSA also wanted to emphasize housing and infrastructure investment. So they are connecting that to some behavioral health issues that are parts of the social determinants of health. So we're actually seeing either a bridge or a transfer of that funding and energy going from one to the other. Of course, trying to understand a full continuum of care. Even our, homeless management information system, right? Made some slight changes to get prepared for this full continuum of care for homeless folks, creating this coordinated access system, right? Which is probably the same thing, but just created to enhance more engagement with the community-based organizations that are fighting homelessness with them. And then this integrated behavioral health approach, where the LCSWs and the MFTs and all of the clinical professionals are strategizing with multidisciplinary lived experience teams. And, as the BHSA tries to emphasize more of those lived experience relationships, integrated behavioral health support is going to be paramount in the years forward. Okay, so just to talk a little bit about the Behavioral Health Services Act, we got the priority approaches, and I'm checking my time. We have the BHSA, the Behavioral Health Services Act priority approaches. Basically they expanded community-based behavioral health services, right? So getting more of those CBOs involved and people with lived experience in peer-run organizations. Integrate behavioral health with the social determinants of health, as I mentioned before, trying to get that integrated service and support together, right? And the biggest one for us is that increase in the use of peer support and lived experience workforce. This is a workforce that our Funky Fresh model is really trying to develop and create more people, engaging more people with lived experience so then they can help others and relate to others as we move into the future. And then, of course, promoting culturally responsive and community-defined practices, right? So Funky Fresh Friday has some impact already into that, right? We're already providing that access to certified peer specialists, right? Integrating those behavioral health services. We provide already with the CalAIM enhanced care management and dehabilitation services, right? Focused on the social determinants of health and how to integrate community engagement with that. There's access to skill building workshops, workforce development projects with SEIU Futuro Health in our attempts to try to increase the workforce of people with lived experience to work alongside managed care plans and specialty mental health service clinics. Right. And then, of course, to strengthen engagement for high need risk population is that non-intrusive entry to service. And then the consistent weekly practice of giving, which is our staple, which is kind of the key to how we want to engage our society. Okay. All right. So I know that I've talked a lot. This is the part where we consider our breakout. So I hope you got your yawning in, maybe stretching it out a little bit, because I'm going to need a little help into breaking out into the questions. I want to give a special shout out and a thanks to everybody who filled out a poll through WOVA and answered some of the poll questions. I thought that was great, and I'll make sure that I can share them after the presentation. And if we're able to do this successfully and break out, maybe we can just do this together. The idea was to just take a good 8 minutes, right? And then get into groups of 5 or 6. How many people do we have today?
Going to be more than that. Let's look, it's 96, 94 participants.
Okay. All right. So then if Nathaniel's there, maybe he can help us do the breakout groups. Is that possible?
And then we have some questions too in the chat.
Yes, ma'am. And so maybe that's what we can go with and kind of just work the chat. Does that make sense? Okay.
Yeah, so I can be the narrator and read the first question.
Okay.
First one I see. Hi, everyone. Miss LaShanya with United and Guided. Good to see all of you. Miss Lori Brown asks, as the leader of this small, cultural, responsive organizations, what are your biggest challenges in meeting your organizational goals?
Yes, that's a great question because our biggest challenges are really around the billing and contracting areas, only because there's just a lot of uncertainty in the future of CalAIM in particular. We're an organization that is founded on a fee for service model. So, without our past cited grant funding, we haven't pursued much grant funding, understanding that, subcontractual relationships with CDPH and the managed care plans was more sustainable for us long term. So yeah, I mean, I would say those biggest challenges are around that. And then, if it wasn't for our particular subcontract funding, we wouldn't be able to do that consistent supply of food, hot food, and things like that. So we really want to reach out and are reaching out to our local community, our corporate sponsors. Anthem has been a great partner, and they became a gold sponsor for Friday. So, their contribution does help with volunteer stipends and buying the food and things like that. But A lot of it comes out of our own pocket and our own time as staff. For our staff, it's very important because we save ourselves from the quarterly mental health retreat because of everyone living so much vicarious trauma through their clients. Instead, we have something that can happen every week where we ingrain it into our work week, the practice of giving, and that never feels bad. And so that's is part of um, how we move forward. But of course, like funding that is unorthodox and is a potential challenge.
So we have a couple of more questions. I have Miss Allison. Hey, she's from First Five. Hey, Miss Allison. She said, can you share how you currently work with or have worked with Black Infant Health?
Yes.
So that was her question from Miss Allison.
Yes. So, we've been working with Black Infant Health for, I want to say since 2020, late 2020, early 2021. That was our first wave of subcontracting. And, it took a while to get there because, there has been that relationship where, we were able to speak at a few engagements with Black Infant Health. We've been invited to a few of the fatherhood conferences. We're still doing that fatherhood representation. We'll be at the International Fathers and Families conference and gathering in LA. So we're still continuing to do that work, but it was Black Infant Health that formed really what we're doing with our co-ed doula work because we realized that, just working with fathers wasn't the full scope of why we were subcontracted for perinatal equity. We really had to find the perinatal portion of that. And I think we did a pretty good job creating a system to try to reach those fathers that are going through pregnancy.
And I think we have time. Thank you, Mr. Lucas. We have time for one more. Miss Sydney. Now, here's the question right here. She said, I think putting us in the future, already predicting our future. How have you spread the word about Funky Fresh Friday and would UAG do road shows of Funky Fresh Fridays to other cities? Already putting us on the map. Okay.
Right. Now, it is our dream to not only put Funky Fresh Friday in other cities, but to replicate the care team in other cities to where we have, a team of lived experience individuals that are dedicated to working with their managed care plans and their behavioral health, specialty mental health clinics and things like that to do not only the Funky Fresh Fridays, but the care management and the economic supports.
I think that was it. I'm gonna go this one more. I think Miss Lucy, I kind of answered it, but I want you to give your input, Mr. Lucas, please. Miss Lucy Hernandez said, she missed it, but she said, what curriculum or EBT are you utilizing for fatherhood and father engagements? I gave my
Yes.
input here.
Okay. And, I didn't mention this in much detail, but I did mention it early. So, there is there were evidence-based programs versus services. So we chose not, even with our subcontract with CDPH, we chose not to use the 24/7 dad curriculum because we wanted to use some turn the curb thinking and we wanted to try to create strategies that we felt would work and be able to test those strategies to see how they go. And big ups to CDPH for really helping us have a blank slate so we can get creative because back in 2020, no one was really talking about fatherhood engagement. So there wasn't a flux of ideas out there to engage fathers. I know, of course, now you see some of them now. But we started just by engaging dads in a public space, in a park, And this was at a time where, all of us were supposed to be quarantined and staying 6 feet away from each other. We were out there with the masks and the hand sanitizer and the thermometers, checking temperatures and things like that. So, yeah, I mean, big ups to CDPH for allowing us that clean slate and to experiment with stuff.
And I don't see any more questions in the chat, but we do have lots of individuals that are asking for further information and all of that good. So we'll get to you all. We'll share the slides and any other information. Yes, is it a deep? I don't want to say your name incorrectly, but yes, we'll share the flyer for the Fresh Fridays, and everything is on our website. We'll get all this information out to you all.
Yes, yes. Okay, so because it seems like there is some time just open for a general conversation. Does anyone want to come off mute and maybe shed some light and share with us?
Don't be shy, y'all.
Hi, this is Lori Brown. I just see a connection between the services you're offering, particularly for mothers and fathers around parenting and childbirth that really connect to prevention of child abuse and neglect. And I'm wondering if you all have looked into tapping into that system in terms of funding and collaboration as a preventative measure for, much of the early child abuse intervention that we see.
Yes. We early on, before we started with CalAIM, we were involved with our regional family justice center, which had a focus on child abuse prevention and domestic violence. And then we still work as a referral source for organizations like that, but we just haven't found that common ground to work on. Some funding issues when it comes to that. But, we were happy. Some of our board members are also on the board of the Family Justice Center. So we're continually looking for ways that we can wrap funding around what we do together. It's a great question, Lori. Thank you. Is anybody else?
I don't have a question as much as I do have a comment, but that fee for service model, that's a killer. That's that old Medi-Cal billing, right? No fee, no service, no fedia, right?
Yeah.
No money. And so when we did Medi-Cal billing, we would say to the therapist, make sure you contact the client, to make sure they come into the office. We have to see them to be able to provide a service, but then also to bill for the service.
Yes.
So, God bless you, brother.
Yes.
And your team.
Hey, thank you, Steve, for pointing that out because this whole CalAIM thing was supposed to be about innovating some of those problems, but it's obvious that, some of them still continue to prevail. What I think is different is that, they are trying to find ways to integrate like central systems that for the billing and the electronic health records management and all those things is still a little scattered, but as some of the managed care plans start to use some of these centralized EDI systems like Availity and Care Central, things like that. They don't have much choice but to get better at that. But for us, like we've had to become masters at the different ways of billing, right? So if it doesn't work with the managed care plan, we've got to go straight to Medi-Cal, which probably still has a lot of the billing issues as it had in the past. So that's probably the slowest part. But like if we can get ahead of that, and build the relationships and closed loop referral systems with the care clinics as opposed to the managed care plans, we might be able to get a better a better billing flow because they're used to billing for Medi-Cal, like the physicians groups and the clinicians, they're used to billing for that. And as long as they can work with us in our W-9, maybe we can get our cut through them, you know. But thank you for that question. Thank you for bringing that up. That's great. Uh, and so I have some other questions, it looks like.
Miss Marjorie has her hand up.
Oh, hey, Marjorie, good to see you. Thanks for
Hi
being on
there.
here today.
Good to see you. Good afternoon. I just wanted to ask, is there a, and I don't know if you would have this data point, but would you be able to share out the time that it takes from connecting and referring into CalAIM into getting services? And then I do have a follow-up question to that.
Yes. And yes, that's a very good question. And the answer is that I don't have particular statistics, but I can explain how our workflow goes, right? With our subcontract with Anthem, we have a member information file of about 3,800 names and leads. So we look for the number. We do the initial outreach to give those folks a call, see if they're interested or declining. And if they decline, we're able to bill for an outreach credit on the spot. But some folks, they still need to be able to build some of that trust, and they're worried if it might be a scam when they receive an initial text. But they do get a link to be able to check us out online. And that's really helped with like the legitimacy. So folks that do get referred, it could take anywhere, from a week to a couple of months. I know that CalAIM tries to give us this like 30 to 90-day window, and we do the best we can with that. But the way we've kind of sped up the process is by having all the forms on our website. So even if you wanted to make a referral, you go right there to the website, fill it out. And then we direct you back to the website to fill out your health benefits review, which asks questions about your managed care plan, and then to create a personalized care plan. That's a whole tab on our website as well, and it's broken down into five different sections, and there are tabs on every section for that. So, folks can go and take their time into creating a personalized care plan. But that care plan has become our staple product. So, we can't promise you're going to get the housing. We can't promise you're going to get this money. You can't promise you're going to get a job. But what we can promise is that you'll get a custom plan that you can either take with you to another professional, or you can work with us to try to accomplish.
Thank you so much. I just had a quick tiny follow-up. And in that in-between space while the client waits, your organization is so amazing. You do so much. Have you found that it's like a best supportive practice to engage them in events or even help them or hold like a warm hand into a pilot project or into like what can we do as service providers and as folks who are convening and collaborating with other agencies within our region to alleviate some of that weight and anxiety while they're waiting to receive the services?
Yeah, and so honestly, if it's not the weekly engagement Funky Fresh Fridays we do, we're still looking for answers to that question, Marjorie, to be honest. Like I feel like for us, like the way, because you're not gonna be able to force anything on anybody like that. You're not gonna be able to force people into programming. We're seeing that as the years pass by, and you're gonna have to get over this stigma of distrust. So, if you think of it through the eyes of someone homeless, you have a lot of distrust anyway. For whatever reason, you're out on the street. It's got to be something that has its own stigma and that you may be embarrassed about anyway. So how do you re-engage with all of the digital marketing and the links and all of this information without a human being to be able to talk to? I feel like, the way things are now, human interaction is going to be like platinum, like trying to actually speak to a human being for your mental health needs is going to be such a rarity that, people with that lived experience and people that can hold informal conversations at first to build trust, they're going to be the ones that actually engage in the people that need to be engaged in. Yeah. Thank you. That was a great question. Thank you, Marjorie. All right. I mean, it's been a great discussion, but I love nerding out on this stuff. I've been thinking about this for about 6 years. And we're just really happy that we at least have a plan of action, whether it works or not work, we definitely have a plan of action. It seems to be effective with the amount of folks there. Maybe Miss Lashanya, since people are making comments, maybe you can kind of chime in. And if there's anyone else from United and Guided, let folks know that it's not just me.
It is, and I think we pretty much did a very good presentation. It was thorough. And I love the questions, and we're all about collaboration. And then I also, Miss Margie, I heard you. As Mr. Lucas said, we try to stay engaged as much as possible. But I think the key to our success with keeping our families engaged until they're connected to one of those CalAIM services is building the beginning of the trust, listening, not making them feel like, outside. Just intentionally listening to the need, and then it's not over exaggerating what we can do, but even if it's something small, like Mr. Lucas said earlier, feeding them on the weekly, or I need paper printed, or could you help me get my photo ID? We have forms for that. Just meeting little tidbits to build into that trust, and then they have the buy-in. It is hard. I think that is our superpower here at United and Guided, is we have a great elite team. Everyone has a great personality. We know how to engage. We've all had our lived experiences from all walks of life. So I think when they see that, they can see that connection. Not to boast, but we're small, but we're mighty. And we would love to collaborate with you all in the future. Hopefully soon, come to Funky Fresh Friday. And sing or sing, whichever. Come out and join.
Yes, yes. Yes, yes. So I'm going to share my screen one more time for those of you who want to just get a snapshot of the QR code. We do have an ebook, talks about Funky Fresh Friday, the way what we try to do with it, and how you can get involved. It's at www.unitedandguided.org/FFF for Funky Fresh Friday. And this is basically our ebook on how to invest in community. It's free. It's right there on the site. You don't necessarily have to peruse it, but definitely, take a look and get some points about how we want to try to run our outreach and engagement. This could be potential partnership for everybody that's working with full service partnerships, specialty mental health service agencies, people who are still doing the county programs. If you're a community-based organization that has a large population of Medi-Cal members, all of those folks would make great potential partners. And, hopefully we can work with every last one of you moving forward in some way or another. Yeah. So can everyone see that? Okay, good. Yeah. So we did pretty good, y'all. I think this was supposed to be over at 3:45. Got 5 minutes. I could either give you those 5 minutes of time back, I really appreciate your questions and all the comments that I saw in the chat, the congratulations. Thank you so much. We appreciate that. Love to just hear some feedback. Um, maybe when you contact us, take a look at the site, see what you like and think, and maybe we can have some conversation, and I hope we do.
Miss Allison and Miss Linda will be in contact. Will be in contact with you.
Awesome.